Hi there, and welcome to today's Heart Health and Pulmonary Education topic, controlling your blood pressure. Let's learn more about what it is and what the numbers indicate. What makes a good or a bad blood pressure? Let's find out. High blood pressure is often called a silent killer because you don't feel any symptoms if you have it. Because of this, many people don't pay attention to what their blood pressure really is. Don't make this mistake. Have someone help you get your blood pressure taken regularly. If you have high blood pressure, you are more likely to get cardiovascular disease. If you already have heart disease and you also have high blood pressure, you are more likely to have a heart attack. Now let's learn more about what our blood pressure numbers really mean. The systolic number, also known as the top number, represents the pressure in our arteries when the heart beats. Diastolic blood pressure is the pressure in our arteries between heartbeats, or when the heart is relaxed. Next, let's learn about the categories of blood pressures. So, how do we know when our blood pressure is too high or even too low? Thankfully, there are categories that can help explain what is considered a healthy or unhealthy blood pressure. Within the first category, normal blood pressure should be around 120 over 80 mmHg. Let's remember, our systolic number is on the top and the diastolic is on the bottom. For those who have a blood pressure reading of 120 to 139 over 80 to 89 would be considered to have a prehypertensive reading. The last category is the most concerning, with a blood pressure reading of 140 or higher over 90 or higher. These readings indicate how healthy your heart is and how hard it is working to pump blood. High blood pressure has many risk factors, including age, race, family history, and more. Let's discuss a little more what each of these topics really are. The risk of high blood pressure increases as you age. Until about the age of 64, high blood pressure is more common in men. Women are more likely to develop high blood pressure after the age of 65. High blood pressure is very common among people of African heritage, often developing at an earlier stage in life when compared to Caucasian or other ethnicities. When it comes to family history, it is common to have high blood pressure run in families through multiple generations, so it's important to let your doctor know if any family member presents with high blood pressure. As weight increases, so does the need for oxygen-rich blood and nutrients to reach our tissues. As the amount of blood flow through the heart increases, so does the pressure within our artery walls. Inactivity can cause a higher resting heart rate, meaning the higher the rate, the harder your heart must work through each powerful contraction. The beating of your heart means that there is stronger force on your arteries. A lack of physical activity will increase the risk of being overweight, therefore increasing the risk and probability of a high blood pressure. Too much sodium in the diet can also cause our bodies to retain or hold in fluid, causing an increase in blood pressure. Not enough potassium in the diet is unhealthy due to it being used to help balance the amount of sodiums within our cells. A proper balance of potassium and sodium is critical for good heart health. If the intake is too much or too little, sodium can build up in the blood and increase blood pressure as well. The overconsumption of alcohol can damage your heart over time. A glass of wine or a few beers in moderation is considered normal, but alcohol in excess will affect your blood pressure in a negative way. Stress is also a huge contribution to high blood pressure and can lead to a temporary increase in your blood pressure. Stress-related habits such as eating more than usual, using tobacco products, or drinking alcohol in excess can lead to further increases in blood pressure. Lastly, certain chronic conditions also may increase your risk for high blood pressure, including kidney disease, diabetes, and sleep apnea. Now that we know how to take control of our blood pressure, let's review some key points to leading a heart-healthy lifestyle. Firstly, know your numbers. Have your blood pressure checked regularly. Keep a log to share with your healthcare team. Stay at a healthy weight. If you exercise and keep your weight within a healthy range for your age, you may not have to take blood pressure medications. Get on a healthy eating plan. Talk with your doctor about seeing a registered dietitian. They can help you learn how to take care of high blood pressure through healthy eating. The dietary approaches to stop hypertension, or the DASH diet, can help you lower your blood pressure. Be active. Get at least 30 minutes of physical activity for most of the days of the week. This could be walking, biking, swimming, or even doing yard work. Choose an activity that you enjoy. Be tobacco-free and stay away from secondhand smoke. Take your medicine if you need it. If your blood pressure is still high even after you change what you eat and how much you exercise, your healthcare team may prescribe medication. Always follow your doctor's directions for taking your medications. Lastly, talk to your healthcare provider about the following questions. What is my blood pressure? What does it mean for me, and what do I need to do about it? What is my blood pressure goal? And remember to set small yet achievable goals on your steps towards a healthier heart. If you do have cardiovascular disease, it is recommended that you try to maintain a blood pressure below 130 over below 80. This information was provided by Maine Health. Visit www.mainehealth.org to learn more. Thanks for watching. Until next time, stay healthy.